In this video, we shall talk about the difference between papilledema and papillitis. Papilledema is defined as bilateral optic disc swelling due to raised intercam pressure. The question is, how does this raised intercam pressure causes papilledema? Raised intercam pressure is transmitted to the subarachnoid space surrounding the optic nerve, which in turn hinders the exoplasmic transport within the ganglion cell layer. So how does normal optic disc looks like? Normal optic disc has a sharp disc margin, while in papilledema the disc margin is blurred. Papilledema is graded according to severity into 5 grades. Grade 1 characterized by C-shaped halo with temporal gap surrounding the optic nerve, while in grade 2 this circumferential halo becomes complete. Grade 3 papilledema characterized by loss of one of major blood vessels as it leaves the optic disc, while grade 4 there will be loss of all major blood vessels when it leaves the optic disc, and in grade 5 there will be loss of all major blood vessels on the disc. Regarding papillitis, which is inflammation of the anterior 1/3 of the optic nerve, while inflammation of the posterior 2/3 is called retrobulbar optic neuritis. Causes include primarily demyelination of the optic nerve, like in multiple sclerosis and neuromyelitis optica. Causes other than primary demyelinating optic neuritis can include inflammation, autoimmune causes, sarcoidosis, drugs, and toxins. How can we differentiate between papilledema and papillitis clinically? Regarding presentation, in papilledema is usually bilateral, while papillitis has a unilateral presentation. The onset of papilledema is gradual over weeks, while it is acute in papillitis. Pain in papilledema is usually absent, however papillitis is painful. What about the visual field? Papilledema primarily affects the visual field, causing enlargement of the blind spot and constriction of the peripheral visual field. It's called tunnel vision. Visual acuity will be affected primarily in papillitis. This will cause marked decrease in the visual acuity and scotomas.